So as of today, we're launching our online quest for finding the best startups. We already have over 4,000 who applied for the edition, but we are going to bring them online. We have announced our global COVID health security challenge. We already have over 200 applications. During the next lives, which will follow, and we will keep you posted. Currently, we have the next live on 22nd of April with the father of internet, Vince Cerf. We shall be announcing some other amazing speakers who will join us on the way. So we will know about it. But every live like this, we will finish it with our commitment to the ecosystem. And this is the best of the best startups in the world. Today, we have chosen 3 of the best, and they will pitch in front of you. But more than that, they will be pitching live in front of some amazing investors. So we have currently 4 investors who will join us here live, and there will be the panel who will vet these 3 startups that we've pre-selected, and one of them will leave that live show with a free exhibition stand at WEBIT, which costs some good amount of money. They will have free tickets for the whole team to be with us live once, when it's available and possible. And they will be allowed to join us at the live on-site $1 million award for the Founders Games. Then there will be only one winner, and maybe those 3, one of them will be there. Who knows? But before that, I would like to introduce you to the panel, the jury panel of investors. We have Mohammad, who is Chief Private Equity and Direct Investment Officer of KFH Capital, Kuwait. We have Anirudh Damani, Managing Partner at Arha Ventures Fund from India. We have Nacho Gimenez, who is very close to my heart, because even though he's in UK, he is from where we were supposed to run the live show this year, Valencia. Why do I say we were supposed to? We are supposed to run the live festival from Valencia. But Nacho, hola Nacho, is Managing Director of BP Ventures, British Petroleum Ventures in UK. And Godska, who is founder and general partner of Acrobator Ventures. Well, hello, gentlemen. Great to have you here. Yes, previously we had 2 ladies in the previous panel. Actually, one, Alexandra from Early Bird was with us. Now I see my team has not done enough, but they hear me well and loud. But it's always a pleasure to have you with us. Thank you for joining.
Thank you so much for having us.
Thank you.
Pleasure to be here. Thank you.
So, are you ready?
We're ready.
Oh, yes.
We have 3 amazing startups who will pitch in front of us and the global audience. I see we have around 6,000 plus current, still 6,000 plus currently on the line. And I will immediately, without further ado, invite here with us on the panel, Susanna Iwanieczko. I'm hopeful I say the name right. Susanna Iwanieczko, presenting WaSH Innovation.
Yes, thank you so much for the introduction. My name is Susanna Iwanieczko, and I am co-founder of CampTap. Iwanieczko, yes. The most mobile sync and tap in the world.
Susanna, just before, I'm very keen on your passion. I need only 1 second from you, if you don't mind, before I click the start button. The rules are very clear. You have 3 minutes to pitch your startup, and we have 3 minutes to ask you questions. And after 6 minutes, we have to make our decision, a couple of 6 minutes like this, we have to make our decision on the winner. And all of your winners being with us on that virtual show. Don't take me wrong, but there must be one that will make the best presentation and that will make us feel like you should be the winner. So the 5 of us will make the decision. So I will start the button now, and you have 3 minutes. Good luck.
Thank you. Thank you. So today I'm here to introduce to you CampTap, the most mobile and sink and tap in the world. During the global pandemic, it is crucial that we join our efforts to alleviate the existing challenges. The biggest one is hand washing. It is absolutely paramount in preventing the spread of viruses and diseases. A large percentage of the world's population lives in urban slums, displacement camps, refugee camps, and remote areas with no access to infrastructure or running water. They have no safe method of sanitation, let alone wastewater disposal. Due to the fact that COVID-19 spread so quickly, it is imperative that they do not touch the tap after using it. We propose a solution, a hygienic, water-saving, portable, and easy-to-use hand-washing device. The heart of the CampTap is the patented valve, which is extremely durable. It can endure 800,000 presses. That's 2 years non-stop pressing on the valve, which guarantees the highest efficiency of water use. It works with no pump or electricity, and due to the gravity feed, it has a very high pressure needle stream. The set comes with a foldable pedal and a latch. So thanks to use the water, we can use it with no touching of the tap or the valve. The stick itself acts as a packaging and allows for the device to be folded and packed within seconds, which makes it very easy for transportation. Here we have a quick video that demonstrates how we can use it without touching. Oh, unfortunately, it doesn't work in that specific presentation, but let's talk about scalability in that case. Because of the high demand for the product, with WHO reporting 1 in 9 people in the world lacking access to safely managed water, we have created a device which can be adapted for all demographic groups thanks to its modular design. We want to sell it with a fair margin. However, we're mostly looking for NGOs and governmental humanitarian organizations working in areas touched by refugee and climate crises, as well as underdevelopment of sanitation, hygiene, and healthcare facilities. We are already maintaining a pretty strong cooperation with humanitarian organizations such as UNHCR and the ACF, which allowed us to test the earlier versions of the device in slums and refugee camps around the world. However, right now we're looking to expand our work with the new model, the CampTap. And after a positive verification of this model, we will be ready to sell it in larger quantities. We are a family startup. It consists of me and
I'm sorry, I have to interrupt.
Okay, no worries, no worries.
It feels always terrible for me when I have to do this. I gave you like 4-5 seconds more, but I think you have
the last slide.
I would let the jury panel now ask the questions. We are vetting on 5 major verticals and principles. We take care of your business model, scalability, uniqueness of idea, capacity, team capacity, and I'm missing something. I will let my jury panel help me with that. So let's start with the questions first. Who would like to start first?
I'll ask a question then. That's here. Can you hear me?
Hello.
Hello. Wonderful project. Just wondering, what stage is your business now in? Is it just an idea, or is it already distributed among hundreds of thousands of users? Did you raise any money?
I will open this question to my teammate, Zdzisław. Would you like to answer it?
Okay, please. Your time is running.
Zdzisław? Okay, well, we have a teammate over here, and I was unsure that he'll be able to answer your questions for the question panel.
Maybe they're muted and they don't know.
Muted. Yes, would you mind unmuting him, please?
Yeah, sure, but your time is running. That's very nice to have different people answering. Can I ask the studio to unmute that particular team member? All right, please. I mean, that's, I don't know if they knew you wanted to. Please answer that question if you may, Susanna. Sorry for that.
Yes. So this is currently a very advanced prototype. We have developed it in support of the research that we did with our earlier prototypes, the handy shower. So right now, we are not really producing yet. We're mostly looking for sponsoring because we have already spent a large amount of money for the molds for earlier prototypes. However, the valve, which is the heart of the product, is can be produced in smaller scales.
Where are you from? Where is the startup from?
It's from Warsaw, Poland.
For Poland, yeah. Okay. Dzień dobry.
Dzień dobry.
I wish I knew more. More questions, please. How much did you raise so far?
We have run 2 crowdfunding campaigns, and I think the cumulative amount that we raised was, I believe, around 50,000 Polish złotych. Okay. We have also obtained a financial support from the European Union because in 2017 we won an award for the best disruptive startup in the category.
That's why I wanted to ask you, because obviously you have proven, you have some already stages proven. Yes. Anyone else for questions, please, from the jury?
So I had a question. What is the real innovation here? Is it the valve? Because I have seen similar valves that are being utilized today. Or is it the fact that this entire thing is mobile? Which one of them is your moat or your USP?
So the valve is the very heart of the project. It is the lightest working valve. With the I think, I'm pretty sure it is the most efficient valve as well. It works very easy, just like tapping on the pen. You can activate it very easily, and it is the highest ranked Polish patent in Geneva, I believe.
One quick question, please, and that's it.
So, Nacho here, Susanna. Thank you for your presentation. Who are your customers? Who are you going to sell to? Is that NGOs or governments? And because this is a mobile thing, so.
Yes, we're looking for humanitarian organizations, both governmental and non-governmental, who are mostly looking for products which can be transported and delivered very easily to places affected by emergencies. Where you don't really have much time or a lot of capacity to bring big, large-scale hand washing devices. We're also looking at maybe smaller organizations that want to buy the product for more individual projects, such as like one specific slum or this internal displacement camp.
Dziękujemy bardzo, Susanna. Thank you so much. That would be it from that wonderful company for now. Maybe we will see them after, depending on the vets of the honorable jury. I was going to have a joke like, all rise, the honorable jury enters the hall. So that's what you're doing. Thank you so much for being with us. We have the next startup coming, and hopefully they're ready. By the way, when you do speeches like this, don't take any chance, right? Your colleague, Susanna, was not able to connect because he was not with a audio on. So this was a chance. And yeah. Now I'm inviting Christian Pascual from Mediktor. Hello, Christian.
Hello, how are you? A pleasure to meet you.
How are you, Christian?
Good. Connecting from Barcelona.
Barcelona.
Yes.
Right. ¿Qué tal?
At home, but busy.
I hope that everything in Barcelona is going to be very soon good, because now Spain is going on a. But we are not going to talk about this because this is the breaking news. My heart is with everyone who suffers. I've lost a couple of friends already to this terrible, terrible pandemic. And I wouldn't say that's, but it's not fair. Especially some of them were not old. They were not old at all. But who am I to judge? Now it's you. Start.
Okay, thank you. So I'm Christian Pascual. I'm the CEO and co-founder of Mediktor. And in Mediktor, since 2014, we have been working to tackle an unsolved problem worldwide, to guide people feeling symptoms to the right level of care. That's our mission to be the gatekeeper for health demand. So we have created the most accurate artificial intelligence-based triage tool, pre-diagnosis and decision support. So it's a medical assistant that you can try online on our website. I'm trying to change the slide, but I'm not sure I can do it.
All right, just from the studio, please. Next slide, if you may.
Okay. So, well, I'll try to continue. Just okay. So it's a reliable and a scalable way to tackle this problem. So next slide, please. Well, I'll try again if I can. So when all these COVID-19 problems started, we saw that we could play a great role with our system. And we created a specific COVID-19 test that was created to ask about the symptoms related to the COVID-19, but also all the 800 diseases that we have in our system. So we can provide not only an outcome that is if you could be suffering the symptoms of the COVID-19, but also a differential diagnosis with other disease, which is great because not everybody is only having the COVID-19. People is having all the normal disease also. And also we are able to tackle if this case is severe or mild, so we can link to the next step to be treated. So we can adapt our outcome to the protocols on each region or country. So it's a very complex system, and it's the only medical assistant that is clinically validated in the world today. It's a software as a service available in 13 languages that you can embed to your interface. So I'm talking without the help of the PowerPoint, but
please use your mouse, use your control of your arrows, up and down arrows. Try it now. You still don't have too much time, but try it.
Okay.
Up and down arrows of the keyboard.
I'm trying with that.
Now you see it works. Magic.
Okay, that's great. I should have the wrong string.
It's okay. Go ahead. You only have 1 second left.
Yeah, sure. We have really good clients together. And
I'll let you for 6 seconds more. So thank you so much. May I ask the honorable jury to start with their questions?
What is the accuracy of your assessment?
It's 91.3 clinically validated with clinical trials that are published in scientific magazines.
And these are the false positives. What is the false positives that you guys are giving out?
Well, we don't pretend to do a 100%. Even doctors don't do it. We just want to effectively triage and pre-diagnose people.
And
the main outcome is send people to the right level of care.
And how are you finding your customers? That's my last question.
Well, we have health insurance companies, telemedicine platforms. We do it with our own team in Europe and US.
Christian, Bas here. Hi. Thanks for the presentation. What I was a bit surprised about is, firstly, you are already active since 2011. Is that correct?
Yes, we started the first concept, thinking about the company there.
And you've raised already over 3 million?
5 million.
Even 5. So you're not really a startup, right? But the goal you are achieving is very beautiful and good. What I wonder is a bit, like I did with the team, we did a quick test. We pretended we were, God forbid, but COVID patients. And we went through your app and we landed on a very basic Spanish page that just linked to the government information page. Now, I can imagine if I have 39 degrees problem with my health and I needed quick care, like Mediktor is not saving my life. So is this just a little bug, or is there still stuff in development that you...
No, it's fully developed. The thing is that our tool in our website, it's a showcase. What makes sense is to link our system to really a healthcare organization to guide them to the best next step in their system. So with the government in a region, we would link the cases to the proper advice that you have locally.
Okay, well, that comforts me a bit. Thank you.
Bas, just for the record, for Founders Games, we never allow companies which are over 5 years of age and up to and above 10 million of investment, because we give them everything for free. That's our grants of 1 to 2 million every year. But in this case, with COVID challenge, we were open to every great solution that could be here, right?
Definitely.
So that's the reason. Please, more questions, if you may.
Christian, Nacho,
Yes.
Nacho, please go ahead.
What is your uniqueness? I mean, there's other remote applications to triage people. What is your IP, your uniqueness, your differentiation? Why Mediktor and no others?
There's just a few companies in the world doing what we do in the same accuracy level. We are the only one in the world today that has proven accuracy with clinical